सोसाइटी के लिए कुछ करना है, हेल्थ के बारे में कुछ करना है, और कोई ह्यूमन बीइंग को कुछ करके दिखाए, इसको लाजवाब।
God has created human being to help people.
गॉड हैज क्रिएटेड, हमें जो बनाया गया है, भगवान ने जो बनाया है, तो हम उसके लिए कुछ ह्यूमन बीइंग के लिए दे के जाए, ऐसी सर की भावना है हमारी।
This gentleman manufactures best drugs in the whole country, Sudarshan Pharmaceutical. With him and a doctor like me, we save life.
Yes.
Drug plus doctor, life saved.
Life saved.
Drug alone.
Yeah.
So we are discussing about heart attack. We introduced this loading dose concept in Coimbatore 5 years ago, 6 years ago. It has gone viral. This loading dose concept, jokul enna vechirukkinga? Only visiting card, credit card. Inge loading dose enge. Loading dose na enna sir? Loading dose is a combination of 3 tablets and that can save life. It is a first aid tablet which can save life at a dire situation. You are traveling in a bus to Tirupati. You are going in a flight to Delhi. You are traveling in a Duranto Express to Chennai. Suddenly you get chest pain. What to do? The train won't stop in the middle. The flight will not land. And the bus may stop in the middle of a jungle, but no doctor is available. So you need to have a first aid tablet in your pocket. That is what is called a loading dose tablet. Loading dose tablet is 3 tablets have been approved by my cardiologist, Y.V. Rao, Dr. Nityan, and CBS has been approved in Canada and America. So these tablets are kept handy in the pocket, not in the briefcase, not in your car dicky. It must be in your pocket because anybody can get a heart attack. So anybody getting a heart attack, he will have these tablets. He can swallow all the 3 tablets and find out which is a good hospital locally. You will reach there alive. If you don't have the tablets, the doctors there will say you have been brought dead. So this is a life-saving tablet concept has been there for a long number of years. But this concept was introduced in India by the chairman of K.G.Hospital. His name is Padma Shri Dr. Bhaktavatsali. Are there any complications? You ask your doctor, your own family doctor, whether this is worthwhile to take it. So I think it is safe. We have given to more than 1 lakh of people. 1,000 people have been saved by promptly taking this tablet. They are brought up to the hospital. We take them to the cath lab. We do a angiography, angioplasty. We sometimes Dr. Verma does a bypass surgery also. Unless the patient is given a first aid, how to save a patient. Diabetes is one of the notorious starting point of heart attack. Diabetic patients should have a heart checked up. High blood pressure patients should have a heart checked up. People who smoke a lot, who don't do any exercise, sedentary habit should have the heart checked up. Diabetes can contribute for a stroke. Diabetes can contribute for peripheral artery disease. Diabetes can contribute for a triple vessel cardiac surgery which may require bypass surgery. Diabetes can cause a sudden cardiac arrest and death. Diabetes can cause peripheral artery disease. Diabetes can cause peripheral neuritis. Diabetes will cause every disease what is there in the book, Harrison's book. So diabetes, you have diabetes, you will get kidney attack also. Kidney attack is kidney starts failing. Heart attack, you got chest pain. Brain attack, you become unconscious, throw a fit. And leg attack, you have severe pain in the leg. But what about kidney failure and kidney attack? We don't know. So we have got a wonderful specialist by name Dr. Ilango who is sitting with me, and then along with him there is one pharmaceutical company from Bombay. It has come, Sudarshan, who will translate English into Hindi. So because this video is being taken by Sudarshan's company, and the Sudarshan's company have got a fantastic YouTube channel. There are 10,000 subscribers. We want to spread all the good things, public interest That is, this is not advertisement for Sudarshan or Dr. GB or KG. This is to propagate what is the early warning signals of a disease and how do we prevent the progression of the disease, how we can manage the kidney failure.
GB's loading those concepts. That's all sorts of blood transfusions for poor people. Thalassemia patients should visit free. She also helps blood transplantation by doing ABO incompatible. And she removes the antibodies from the patient. The recipe manager who has been with us for 35 years. He is in charge of the whole laboratory. And this lady is Rani. And this is Sundara Murthy. Tilagani, they are all in charge of the laboratory. We do every test here. One or two tests we are not able to do it, we send it to somebody else. We send it to Metro Plus or some other. So most 99% of the tests are really quality oriented. They have internal quality, they have external quality, and it is meant for external quality.
Very good organized.
Very good, well organized.
Neat and clean.
Yes, sir. Good signage is also.
Yes.
You know, thank you, Dr. Tilagani.
Really impressed.
You went round?
Yeah. Went down from eye surgery and the dental clinic and here only.
Okay, I'll show you one other important area which you may like. Because this is where we capture all our patients. We have 85,000 eye surgery patients. The reason why we do it is
Definitely we are in the company social like Reliance Industries, like Sun Pharma. कि भाई आप donate करो.
Why not?
Give donate of the life saving dose.
we'll give it free of charge to all the so-called police people. Police people,
okay.
They are the people who will get heart attack.
Correct.
So we're not asking for money. You are ಅದಕ್ಕೆ ಒಂದು ಬರಿಯ ಲ್ಯಾಬ್ ಕಾಣಿದೆ ಇದು ಕಟ್ಟು ಬರೆ ಆರ್ಟಿಕಲ್ಸ್
oldest staff 40 years with you.
Yeah.
The lady name I just forgot the name. This is about the pronunciation.
This is a temporary emergency light program.
Okay.
This is called a triage. The patients are seen and they are shifted to the intensive care. Small but very powerful. And what we believe that here in the emergency room we have got gods working with us. Hare Rama, Rama Rama, Anjaneya. So this is Lord Kartikeya, Anjaneya. This is all these people. This is
This is Om Shanti.
Om Shanti.
Om Shanti.
Baba. That is Maharishi. This is Mata Mritandamayi. This is Shirdi Baba. This is Christ. Radhe Krishna. This is Jagannath. Subhadra. Lakshmi Narayana. So all these people stay with us for saving lives.
Yes, sir. Great.
So when you're sick, you don't go to the temple. No? You come to the hospital.
Yes.
Here you come to K.G. Hospital. You come to K.G. Hospital and the temple.
And the temple.
Combined. So
Great.
the Dr. G.B. alone 50% success.
Yes.
But G.B. with God,
blessing.
with God,
With God blessing.
100%.
100%. Yes.
We have a heart scan. Heart scan. This is how the heart scan is done. CT scan you would have seen. CT scan. And this is how we look at the heart also. This is how we look at the heart.
Okay.
Not angiogram. Here CT scan we create a heart like this. This is you look at the block here.
Okay.
And this fellow suddenly gets a heart attack, he needs a loading test.
Yes.
Because it will take at least 2 days for him to get operated.
Correct.
In the hospital itself, we can get a heart attack. This is 99% block. It becomes 100% block. The artery doesn't supply this area. Heart attack.
Okay.
So he needs a stenting.
Okay.
This is the 128 slide CT scan. Here it comes. This is a 128 slide CT scan where the patient goes inside and then the machine rotates per second 128 times. Right. And then the heart is scanned in 5 seconds. Only 5 seconds you can lie down. We give a dye, injected dye, and the patient's heart will be seen in the console. The injection of the dye is done by a machine. 80 ml of the dye is injected by a machine. Come back. This is the cardiac unit.
So this is a yes.
That is the artery which is supplying the heart. The white stuff, that is artery 1, artery number 2. And then if the artery gets blocked, then we get a heart attack. So this patient has had bypass surgery. Those are all small clips they are shown. And the big artery is the aorta. That is the aorta. The aorta. Those vessels are blood vessels are going into the brain. Upstairs. This is the bypass surgery. It's been done. Post bypass surgery, if the patient develops heart attack, again we do a CT scan. We don't have to do a CAT. That is the stent which has been applied inside. Stent. It costs about 20,000 to 40,000 rupees. The stenting procedure costs about 1.5 lakhs rupees. And this is a broken heart, broken aorta. The main vessel is broken. Pipe is broken. So this is what is called dissecting aortic aneurysm. We do it, we do about 60 to 70 cases. The patient comes with a stroke,
Sir, if it is possible to give me one case study by mail,
Yes.
so it is very convenient to.
Sure. One case study, sir. One cardiac patient who has card. Triple meningitis. Meningosis. Photo. Baby, show me some other MRI. It's a 4-day-old baby.
Oh.
Baby has got some bulging here.
Cancer, CA, but which is.
Everyone can put either brain tumor or something. Infarct. So the patient had a high blood pressure and a hypertension, and then the patient suddenly could not. She's a 62 years old lady, and then she could not move the hand.
Right side.
Right, she could not move the hand, and there is a infarcted brain. That is means that area of the brain is not getting the enough blood circulation. So that is called, we call it as a stroke, ischemic stroke. The heart muscle is not getting blood circulation, the patient will have severe pain. But the brain circulation is not going, the patient will become unconscious. He perfuse the brain. Okay, put the like a thrombolysis here.
Yes.
Anti-clotting drugs.
To see a cervix.
Cancer, cervix. This is the cancer in the uterus. But in the uterus, it's bladder. Which is the bladder? That's the bladder, urinary bladder. The whole uterus is normal, but the cervix is cancer. Entry into the vaginal passage is cancer. And one in the morning. Get up in the morning and first you take whatever. Okay. Between the capsule, morning breakfast, only 1 hour later, no storm, you will get better. Your doctor suffers from similar disease.
Thank you.
So the ambulance is straight here. Don't go to the hospital. Don't go to here. Straight, the patient is in bad condition. Put him here. Treat the patient. All fluids, all shock, EEG, everything is available. Then this arrangement is not there in Bombay. Front office manager. Morning. See you. He's the front office duty manager.
Yes.
This is our outpatient department. We'll demonstrate one small We announce code blue Jahangir is OP. Let me see what. We'll announce code blue. That means it's an emergency situation.
Emergency situation. Yes. What will you do?
What will you do? Then you can't say come doctor, come doctor.
Yes.
So what we do, we announce it in the public address system. Code blue.
Okay.
Dr. Jahangir is OP. She's gasping out. That is of Jahangir. Nothing happened in the room. That girl is only getting order. She thought Dr. Jahangir is sleeping and not sleeping through it. Code blue. Code blue means it's an emergency. Still girls are coming. Still doctors are coming. This is only a mock drill. I'm very sorry to make you run. It's mainly to find out how alert are you
on a Saturday evening, 5 o'clock. Sir, almost
Yes.
weekend. Still they are running, no?
Still they are running.
So I think they deserve a big applause. Big applause. Very good. God bless you. God bless you. God bless you. Phone பண்ணீங்க கிடைக்கல. Phone clear.
Sir, it is amazing, amazing.
See what is happening in a hospital.
Yes.
See what is the hospital. Paper. Yes. See all the fellows are alert. And by the time you conduct the talk, the patient is almost that's why
Electrician.
Any of the patients testing every day about 20-30 people undergo testing. No, this is necrocardiography. Wherever you go, patient will go there. Yes. Wherever you go, then there is people. Smileful. And smell less.
Very nice, very nice. And the 100% cleanliness is there.
Smileful, smell less.
Yes, sir.
And people are being treated in a little more. Dr. Vasan, the lady from Russia, she is a budding doctor, house surgeon.
வணக்கம் டாக்டர் சிபிஎஸ் ரொப்பி
Come.
டாக்டர் இல்லைங்க பார்த்துக்கலாம் பத்மா சார் இருக்காரு
Everyone is happy. Happiest.
They want to have a small interview with you. Cardiac surgeon or acute person. Sir. Take, no, please. And take the photograph. You'll ask questions. Ask questions.
Nice.
Because I'll be leaving now.
Okay.
So I leave it with you.
Okay.
You have an interview for about 5-10 minutes.
Okay.